I will be talking about the cons of Medicaid. Problems that necessitate the policy. Medicaid enhances access to healthcare services for low-income individuals or families who may not be able to purchase private health insurance. One of the critical challenges that this group faces is the lack of access to health care. In 2018, Medicaid was the source of health insurance for 97 million lower income Americans, comprised of children, adults of all ages, seniors 79 years old, and people living with disabilities. In the United States, pregnant women and children eligibility for Medicaid was expanded dramatically during the 1980s and the early 1990s by lowering pregnancy and child health care costs. The Medicaid expansions may have increased the incentives for women to have children. To investigate this possibility, they examine whether state-level birth and abortion rates are related to extent of states' Medicaid eligibility expansions and the fraction of women eligible for Medicaid, controlling for economic and demographic factors during the period of 1982 to 1996. Policy description. Medicaid is the public health care program governing medically needy and low-income people. Since its inception in 1965, it has largely covered different categories of people like kids, parents, pregnant women, seniors, and the disabled. The federal government and the states both fund, and the states have the option of self-administered programs supported by federal regulations. History of the policy. The Medicaid program was introduced as part of the Social Security Amendments of 1965 to meet the essentials of providing healthcare coverage to the vulnerable group. This program has been subject to modifications and the extension of coverage ever since. It includes the Medicaid expansions of Affordable Act in 2014. Proponents of the Medicaid expansion claim that it is the most economic tool that provides access to health care for less privileged groups, improves health outcomes, and decreases medical inequality. Critics claim Medicaid is a high cost, inefficient, and discourages people from working. Medicaid, the problem that necessitates the policy. Medicaid finds its role in the high-end solution in the provision of healthcare services for low-income individuals or families who may not be able to purchase private health insurance. One of the critical challenges that the group faces is the lack of access to healthcare. In this case, people may postpone, even avoid proper medical care, and their disorders might worsen and the cost of care may increase over time. Facts and statistics about the problem. In 2018, Medicaid was the source of health care insurance for 97 million lower income Americans, comprised of children, adults of all ages, seniors 79 years or older, people living with disabilities. Policy description. People is the public health care program governing medically needed. Coming to its inception in 1965, it has largely covered different categories of people like kids, parents, pregnant women, seniors, and the disabled. Whether one qualifies for Medicaid depends on the state, and the benefits that you will receive differ from state to state. States are given a lot of power in designing and administering their Medicaid programs. History of the policy. The Medicaid program was introduced as a Social Security Amendment in 1965 to meet the essential goal of providing health care coverage to the vulnerable groups. The program has been subject to modifications and the extension of coverage ever since. In general, Medicaid has proven to be an effective strategy to provide healthcare coverage to the low-income population and improve healthcare access for them. Reports have established that Medicaid provisions bring about better medical results, less medical debt, and ensure financial stability for parents. Policy recommendation. Policy proposals for Medicaid can include factoring in the efficiency of administrative procedures, enhancing payment rates allowed to providers, and broadening the coverage options for particular populations.